Assalamu alaikum rahmatullahi wa barakatuh. Happy Mandela Day to all our viewers at Hilaal TV. So today we've decided to go out and have the spirit of Mandela Day, our late great former president. Today we are starting off at the Nelson Mandela Children's Hospital. And joining me, I'd like to welcome the Chief Executive Officer of the hospital, Dr. Nonkululeko Boikhutso. Doctor, thank you so much for hosting us here.
Thank you so much for joining us on Mandela Day.
No, it's an absolute pleasure. I was told that this hospital established in 2015. I thought it was a very old hospital, so a little bit of a lesson there for me. When we talk of the history of this hospital, why was it necessary to have a hospital in honor of our former great president?
First of all, our former president believed that we should do something for children. In fact, he dedicated most of his charitable work to taking care of children. He started the Children's Fund, which wants to change the way in which society treats its children and young people. And there was also a realization that we need a children's hospital in Johannesburg. We do have one in Cape Town, the only one in South Africa at the time. And we're the only second children's hospital in South Africa. Our children are receiving care in other hospitals, but sometimes they have to wait for a very long time, and they're competing with adults for resources in some of our bigger hospitals. So there was a need that we need to have a hospital just dedicated to children.
And then, of course, you speak about children, and of course, they remain the most vulnerable in society on so many aspects. And I had a walk around the hospital, and there's warmth in this hospital. There's a sense of security in this hospital. And that's what the children of our country deserve, isn't it?
Absolutely. This hospital was designed with children and their families in mind. So we allow moms and dads to be here, to stay with their children, and we take care of the most vulnerable, regardless of their ability to pay. So any child can receive care here, as long as they have the diseases that we can treat in the hospital.
Doctor, when we talk of the man himself, Nelson Mandela, the great former president, um, his love for children was something that I think a lot of us as South Africans still need to reach. And this is the beauty of it, isn't it? That his spirit still now lives on many of us.
Definitely, it does live on. I mean, he dedicated the 67 years of his life fighting for social justice, for equality and freedom for us to live the way we live today. And so really, this hospital is a representation of his legacy, how much he loved children. If you can remember, during his presidency, he dedicated a third of his salary towards the Nelson Mandela Children's Fund. And so he just not only put his work, but his money in taking care of our young people.
The hospital, what is in here that, children, obviously, from obviously the ages of being a baby till up about 16, 17, what services can they get here, of course, if they have certain sicknesses that can be treated?
So most of the children that come here have specialized conditions. We are a tertiary referral hospital, so the patients have to be referred to our hospital. We treat children with heart problems, so those who are born with congenital heart abnormalities, kidney problems. So we've got a lot of children on dialysis in our hospital who require transplants. Those who have abnormalities of the brain as well, so we have neurosurgical, neurology services, pulmonology, and a lot of our services here are actually surgical, because there's a realization that surgical waiting lists are very long in the public sector. And so we were here to really address those backlogs from a surgical point of view.
Administrative wise, I know it's sometimes difficult to separate emotion from, of course, the professionalism of your job. But being that this is a hospital in honor of the late president, how do you balance the emotions with the professionalism, knowing that he would have wanted every child in this country to have the equality to health as enshrined in our constitution?
That's a very good question. It's very difficult to separate emotion from the work. Our work is very emotional. And I always tell people we want people to bring their heart to work, because without the heart, we wouldn't be able to do the work that we do. But we also remember that we can't help absolutely every single person. It's our attempt to try and help as many people as possible. But the realization is the resources are not enough. But it's always good to aim to take care of everybody.
As a medical practitioner, doctor, how do you remember Mandela and use that as a remembrance for the work that you do? How do you say, today I wake up not only as the CEO of the hospital, but also a practitioner who signed the oath of office to say, it's my duty to look after anyone who has any disease within this country.
So, Mr. Nelson Mandela dedicated his life. He spent so many years in prison. All I have to do is to show up. He made the biggest sacrifice, some of which none of us will ever make. And so for me, it's about dedicating my time, dedicating my heart, and making sure that we show up for our patients and do the best that we can. And the Hippocratic Oath is important. We took an oath to do no harm to patients, to put our patients first. And that's something that you remember every single day and appreciate the sacrifices that were made by Tata Mandela and so many others who fought for this country.
And how do you inspire your staff the way he would have inspired a nation? We talk of 1995, the Rugby World Cup. We talk of 96 Africa Cup of Nations. There was a euphoria in our country that we wish we could go back to, but of course we have to look forward to the future. So how do you as Dr. Nonkululeko say, today I'm going to inspire my staff on a day that probably they need that inspiration using the spirit of Mr. Mandela?
So one of the things I like doing, apart from having town halls and meeting with the staff, is just being on the ground every now and then and talking to the staff and finding out how they're doing. It's small things that people appreciate, and that's how we try to inspire and reminding them of the great work that they do. So we do take a lot of footage and show them afterwards to see, look at what you're doing. Because sometimes when you're in it, you don't see how amazing the work that you do is. And so that's what we try and do all the time, and just touch base with staff members regularly to see how they're doing.
What does Mandela Day mean for you, Dr. Nonkululeko Boikhutso? How important is this day? And how do you try and use it as a tool of motivation, a tool of inspiring yourself and your fellow staff members for the rest of the 364 days?
Sure. I always tell people, yes, Mandela Day is one day, but actually every day should be Mandela Day. And when you work in the space that you work with, dealing with humanity and vulnerable communities, you're reminded every day of the importance of lifting others, of taking care of others. And for me, as a young South African, I absolutely appreciate the work that was done, because I wouldn't be here talking to you today if sacrifices were not made. So that in itself is inspiration for me and reason that I should work and continue to do the work of the hospital, which is about Tata Mandela's legacy.
What is your favorite memory of the late president? What would obviously he had passed on December the 5th, 2013, and left a huge hole in South Africa at the time. But if you were to look at the times before, what would be your memory that stands out of the former president?
So for me, obviously I was very young when he was released from prison, but I remember that day very well, and the excitement, because I'm from Soweto, and the excitement in the community about this Mandela who's coming out of prison. You'd heard so many songs about him and we had never seen him. And just for me, that day was the most memorable. And there's actually another memory, one child, we got a picture of him carrying a child. And just that for me stays with me and shows me that how much he loved children. He was always surrounded by children. And so really that's a memorable experience, and it makes me realize the importance of this hospital and working here.
What would be, as a final question, your message to South Africans, not only for Mandela Day, but for the rest of the year, so that we can keep the Ubuntu that he's always wanted us to do, the unity, the love amongst us as South Africans?
All I want to say to South Africans is that we can do it. We are a country that's gone through a lot, but South Africans are resilient. We laugh, we make jokes. If you look at whenever we have tragedy, we laugh about it. And so we're wonderful people. We're people who are strong, who are resilient, and we must continue to do so despite whatever challenges we face as a country. There's so much that we can do as a community. If we partner with government, civil society, corporates, we can make a difference in this country.
Dr. Nonkululeko, thank you so much for joining us, and continue doing the good work that you're doing.
Thank you very much. Thank you for coming and joining us today.
Absolute pleasure. That is Dr. Nonkululeko Boikhutso, the Chief Executive Officer of the Nelson Mandela Children's Hospital. Stay tuned to the special edition of News in Focus because we're going to be going ahead and getting more interviews to honor Mandela Day.
From myself, Dr. Nonkululeko Boikhutso, all the Nelson Mandela Children's Hospital staff, our parents, and especially our children, we'd like to thank everybody who's joined us today and everybody who's doing good for community all over South Africa. Thank you so much, and happy Mandela Day.